Have you noticed changes in your sleep patterns as you've gotten older? Perhaps you're waking up earlier, having trouble staying asleep through the night, or feeling tired earlier in the evening. These changes aren't just in your imagination, they're backed by scientific research. According to a comprehensive study published in the Journal of Sleep Research in 2021, approximately 50% of adults over 70 experience significant alterations in their sleep architecture. But why does this happen? Let me explain the biological changes occurring in your brain and body. First, our production of melatonin, often called the sleep hormone, changes dramatically as we age. A landmark study from Harvard Medical School in 2019 found that by age 70, the timing of melatonin secretion shifts forward by approximately 1 to 2 hours compared to middle age. On screen, graph showing melatonin production patterns across age groups. What this means is that your body naturally begins to produce melatonin earlier in the evening, typically around 7 hours and 8 hours p.m. rather than 9 hours and 10 hours p.m. as it did when you were younger. This biological shift explains why many of you feel tired earlier in the evening. Perhaps most significantly, research from the National Institute on Aging shows that adults over 70 experience a 30–35% reduction in deep sleep compared to younger adults. This critical slow-wave sleep stage is essential for memory consolidation and cellular repair. On screen, brain wave patterns showing reduced deep sleep waves in older adults. It's important to distinguish between normal age-related sleep changes and actual sleep disorders. The changes I'm describing, earlier sleepiness, less deep sleep, and more nighttime awakenings, are natural adaptations of your aging brain. They don't necessarily indicate a problem, as Dr. Matthew Walker from UC Berkeley's Center for Human Sleep Science explains. Sleep changes with age, but it doesn't have to deteriorate. Understanding these natural shifts allows us to work with our bodies rather than against them. For those of you in your 70s, 80s, and beyond, recognizing these biological changes is the first step toward optimizing your sleep schedule. By aligning your bedtime with your body's new biological clock, you can significantly improve both sleep quality and overall health. In the next section, I'll reveal exactly what time research shows is optimal for those over 70 to go to bed, and why this specific timing matters so much for your health. Now that we understand why sleep patterns change with age, let's address the critical question: what is the ideal bedtime for adults over 70? A comprehensive 2020 study from the National Institute on Aging tracked the sleep patterns of over 1,200 adults aged 70–85 for 3 years. Their findings were remarkable. Participants who consistently went to bed between 9 p.m. and 10 p.m. showed significantly better sleep quality compared to those who went to bed earlier or later. On screen, graph showing sleep efficiency across different bedtimes. But why is this specific window so effective? The answer lies in how it aligns with your body's natural circadian rhythm. According to research published in the Journal of Sleep Medicine in 2019, adults over 70 who went to bed during this 9 hours and 10 p.m. window experienced 23% better sleep efficiency and significantly fewer nighttime awakenings. The researchers concluded this timing optimally coordinates with the shifted melatonin production we discussed earlier. Let me explain the science behind this. Your body's internal clock, called the suprachiasmatic nucleus, regulates your sleep-wake cycle. As we age, this biological clock shifts forward, causing earlier melatonin release. By going to bed between 9 and 10 p.m., you're capitalizing on your natural melatonin peak rather than fighting against it. On-screen diagram of brain highlighting the suprachiasmatic nucleus and melatonin pathway. Dr. Elizabeth Claremont from Brigham and Women's Hospital explains, going to bed during your body's natural melatonin window increases the likelihood of falling asleep quickly and maintaining deeper sleep throughout the night. I want to emphasize that this time frame is a guideline, not a rigid prescription. Your optimal bedtime might vary based on your personal chronotype, whether you're naturally a morning lark or night owl, existing health conditions, medications you're taking, your daily activity pattern. The key is consistency. Research shows maintaining a regular bedtime is often more important than the exact hour you choose. When my patients ask about this golden window, I encourage them to experiment within this range to find what works best. Some find 9 p.m. ideal, while others prefer closer to 10 p.m. The right time is when you can fall asleep within 20-30 minutes and wake feeling refreshed. Next, I'll share the specific health benefits researchers have documented when older adults align their bedtime with this optimal window. When you align your bedtime with your body's natural rhythm, the health benefits can be substantial. Let's examine what rigorous research tells us about these improvements. A 2022 study published in the Journal of Gerontology followed 50 adults over 70 for 18 months. Participants who maintained consistent 9 and 10 p.m. bedtimes showed a 20-25% improvement in memory retention tests compared to those with irregular or later bedtimes. On screen, brain scan images comparing neural activity during memory tasks. This memory enhancement is directly linked to what scientists call glymphatic clearance, essentially your brain's cleanup system. Dr. Macon Nittergaard, who discovered this process at the University of Rochester Medical Center, explains, during deep sleep, the brain's waste removal system becomes 10 to 20 times more active, clearing out proteins that can lead to cognitive decline. On screen, animation showing the glymphatic system clearing beta-amyloid proteins. Beyond cognitive benefits, your cardiovascular system also benefits significantly. The American Heart Association published research in 2021 showing that adults over 70 who maintained consistent early bedtimes experienced 15 to 20% lower rates of hypertension and improved heart rate variability, a key marker of cardiac health. Dr. Susan Johnson, cardiologist at Mayo Clinic, confirms, we regularly see improvements in blood pressure readings when our elderly patients optimize their sleep timing. The effect is comparable to some mild blood pressure medications, though certainly not a replacement for prescribed treatment. Mental health improvements are equally impressive. A University of California study from 2020 documented a 25-30% reduction in anxiety symptoms among older adults who adjusted their bedtimes to match their shifted circadian rhythms. I recently spoke with Robert, a 74-year-old retired engineer who participated in our sleep clinics program. I was skeptical about changing my lifelong habit of staying up until midnight, but after adjusting to a 9:30 p.m. bedtime, I noticed my morning anxiety disappeared almost completely. My wife says I'm less irritable, and I feel more like myself again. It's important to acknowledge that results vary based on individual health status, medications, and other factors. These benefits represent averages across study populations, not guaranteed outcomes for every person. In the next section, we'll explore how these benefits might differ among various age groups beyond 70, as sleep needs continue to evolve as we age. While the 9-10 p.m. bedtime window serves as an excellent guideline, it's crucial to understand that sleep needs continue to evolve as we age beyond 70. Let's explore these differences more specifically. For adults between 70-75 years, research from the Sleep Foundation's 2021 consensus report suggests an optimal sleep duration of 7 to 8 hours. This age group often benefits from maintaining a schedule closest to their middle age patterns, with the addition of a brief 15-20 minute afternoon rest period. On screen, chart showing recommended sleep durations by age group. Dr. Jennifer Williams, Director of Geriatric Medicine at Johns Hopkins, explains, the early 70s represent a transition period. Most adults in this range still require a full night's sleep, but begin experiencing the forward shift in their sleep timing. For those between 75-85, sleep architecture undergoes further changes. According to findings published in Sleep Medicine Reviews, this group typically functions best with 6-7 hours of nighttime sleep, often with a slightly earlier bedtime, closer to 8:30-9:30 p.m. for many individuals. Health conditions common in this age range particularly impact sleep quality. A 2020 study in the Journal of the American Geriatric Society found that 68% of adults in this group have at least one condition that disrupts sleep. Most commonly arthritis pain, nocturia, nighttime urination, and gastroesophageal reflux. For adults over 85, sleep patterns often fragment further. Research from the University of Pennsylvania Sleep Center shows that adults in this group may benefit from a biphasic sleep pattern, a shorter nighttime sleep period of 5 to 6 hours, supplemented with a 30-45 minute afternoon nap. On-screen, diagram showing biphasic sleep pattern. Medication interactions become increasingly important with advancing age. Dr. Mark Albers, geriatric pharmacist at Massachusetts General Hospital, notes, by age 85, over 40% of patients are taking at least one medication that disrupts normal sleep architecture. Common culprits include certain blood pressure medications, steroids, and some antidepressants. It's essential to monitor how your sleep needs change as you move through these age ranges. The National Institute on Aging recommends reassessing your sleep patterns annually after 75 or whenever you experience significant health changes or new medication regimens. Remember that these groupings provide general guidance rather than strict rules. Your individual need for sleep is influenced by genetics, overall health status, daily activity level, and countless other factors unique to you. In our next section, we'll explore practical strategies for adjusting your bedtime regardless of which age group you fall into. Now that we understand the importance of proper sleep timing, let's discuss how to successfully transition to an earlier bedtime without disrupting your lifestyle or causing additional stress. The most effective approach is what sleep scientists call the 15-minute method. Research from the Stanford Sleep Medicine Center demonstrates that gradual adjustments are far more successful than abrupt changes. Begin by setting your bedtime just 15 minutes earlier than usual for 3 consecutive nights. Once your body adjusts, move another 15 minutes earlier for the next 3 nights. Continue this pattern until you reach your target bedtime within the 9-hour and 10-hour p.m. window. On screen, calendar showing gradual 15-minute adjustments over weeks. Morning sunlight exposure plays a crucial role in resetting your circadian rhythm. A groundbreaking 2018 study from Northwestern University found that 30-60 minutes of morning light exposure, ideally before 10:00 a.m., significantly improved nighttime sleep quality for adults over 70. The natural blue light wavelengths signal your brain to stop producing melatonin and reset your internal clock. Dr. Phyllis Z., the lead researcher, notes, morning light is the most potent natural timekeeper for our biological clocks, especially as we age. Developing an effective bedtime routine signals your body that it's time to transition to sleep. Clinical trials at the University of Pittsburgh Sleep Medicine Center identified these key components of an effective routine. Begin 45 to 60 minutes before your target bedtime. Maintain consistency with the same activities in the same order. Include passive relaxation, reading, gentle stretching, meditation. Avoid screens that emit blue light for at least 30 minutes before bed. Keep your bedroom slightly cool. 65. On-screen, visual timeline of an effective bedtime routine. For middle-of-the-night awakenings, something 78% of adults over 70 experience, the American Academy of Sleep Medicine recommends, avoid checking the time, which increases anxiety. If you can't fall back asleep within 20 minutes, leave the bed temporarily. Engage in a calm, non-stimulating activity with dim lighting. Return to bed only when feeling sleepy. Tracking your progress helps maintain motivation and identify patterns. Dr. Rebecca Smith from the Mayo Clinic Sleep Center recommends a simple sleep diary tracking bedtime and wake time, how long it took to fall asleep, number and duration of nighttime awakenings, overall quality rating. On screen, sample sleep diary page. Remember that successful adjustment typically takes 2 to 3 weeks. Patience and consistency are key to resetting your biological clock for better health. Beyond timing, your sleep environment plays a crucial role in sleep quality. Research consistently shows that optimizing your sleeping space can significantly improve both sleep duration and quality, especially for adults over 70. Temperature regulation becomes increasingly important as we age. A groundbreaking study from the National Institute of Environmental Health Sciences found that adults over 70 sleep most efficiently in rooms kept between 65 to 68. This slightly cooler temperature helps facilitate the natural drop in core body temperature that signals sleep onset. On screen, thermal imaging showing body temperature changes during sleep onset. Dr. Maxwell Chen, Director of Thermal Regulation Research at the University of Chicago Sleep Laboratory, explains, as we age, our bodies become less efficient at regulating temperature during sleep. A cool bedroom environment compensates for this change and promotes deeper sleep cycles. Light management is equally crucial. The Journal of Clinical Sleep Medicine published findings in 2021 showing that even minimal light exposure during sleep, such as from digital clocks or outdoor street lamps, can disrupt melatonin production and fragment sleep in older adults. Practical solutions include room darkening shades or curtains, removing electronic devices with LED indicators, using amber or red nightlights if necessary for safety, wearing a comfortable sleep mask if complete darkness isn't possible. On screen, before-after images of bedroom lighting optimization. For those experiencing joint discomfort at night, mattress and pillow selection becomes particularly important. Research from the Arthritis Foundation indicates that medium-firm mattresses provide optimal support for older adults, particularly those with back or hip pain. Orthopedic pillows designed to maintain proper neck alignment have been shown to reduce morning pain by up to 40% in clinical trials with older adults. This is especially beneficial for those with cervical arthritis or stenosis. Sound management offers another avenue for improvement. A 2019 study in sleep medicine demonstrated that consistent, non-disturbing background sounds, particularly pink noise, similar to the sound of steady rainfall, improve deep sleep duration by 13% in adults over 65. On screen, sound wave patterns showing different types of noise, white, pink, brown. Perhaps most important are the habits to avoid in the evening hours. Research from Harvard Medical School identified these key disruptors. Screen exposure within 90 minutes of bedtime suppresses melatonin. Evening consumption of alcohol fragments REM sleep. Late-day caffeine, half-life of 5 to 7 hours in older adults. Evening problem-solving or bill-paying activates stress hormones. By addressing both the timing of sleep and these environmental factors, you create optimal conditions for restorative sleep after 70. Let's address some of the most common questions I receive from my patients over 70 about sleep optimization. Does napping affect nighttime sleep? According to research published in the Journal of the American Geriatric Society in 2020, brief afternoon naps, 20-30 minutes taken before 3 p.m. generally don't interfere with nighttime sleep for adults over 70. In fact, for many older adults, strategic power nap between 1 and 2 p.m. can actually improve cognitive function without disrupting nighttime sleep. However, Dr. Eleanor Martinez from the Stanford Sleep Research Center cautions, naps lasting longer than 30 minutes or taken after 3 p.m. often interfere with nighttime sleep in older adults. If you must nap, keep it brief and early. On screen, graph showing impact of nap timing on nighttime sleep quality. What should I do when I wake up at 3-4 a.m. and can't fall back asleep? This common issue, known as middle insomnia, affects nearly 60% of adults over 70. The Journal of Clinical Sleep Medicine recommends a technique called stimulus control therapy, with proven effectiveness. If you can't fall back asleep within 20 minutes, leave your bedroom, go to another room with dim lighting, engage in a relaxing, non-stimulating activity, reading with warm light, gentle stretching. Return to bed only when feeling sleepy again. Repeat if necessary. Dr. James Wilson, author of a 2019 study on insomnia in older adults, emphasizes, the key is avoiding the anxiety cycle about being awake. Getting out of bed prevents your brain from associating your bed with wakefulness. Are sleeping pills a good solution for adults over 70? The American Geriatric Society explicitly recommends against most sleep medications as first-line treatment for adults over 70. Their 2021 Beers criteria, which identifies potentially inappropriate medications for older adults, cautions against benzodiazepines and non-benzodiazepine hypnotics due to increased risks of falls, cognitive impairment and dependence. Dr. Sarah Mitchell, geriatric pharmacist at Mayo Clinic, explains, the risk-benefit ratio for sleep medications shifts dramatically after 70. Most carry significant risks that outweigh their modest benefits. Cognitive behavioral approaches to sleep should be tried first in nearly all cases. How do I know if my sleep problems require medical attention? The Sleep Research Society identifies these key warning signs that warrant medical evaluation: chronic loud snoring with gasping or choking, possible sleep apnea, extreme daytime sleepiness affecting daily activities, persistent leg movements or discomfort preventing sleep, acting out dreams physically, possible REM behavior disorder, significant changes in sleep patterns coinciding with new medications. Remember that many sleep issues respond well to the timing and environmental adjustments we've discussed, but underlying medical conditions should always be evaluated by your healthcare provider.